There was a man who was experiencing a certain neurological condition that made it impossible for him to play guitar, and he needed brain surgery to fix it. His fingers were cramping, and it affects 1% of all musicians. So take a look at his surgery. In order to fix it, they had to, while doing surgery, have him stay awake as they were cutting into his brain and play guitar. It's called radio frequency ablation. His doctor essentially said that this guy needed to play guitar so he could identify which part of this guy's brain to apply the therapy to. And of course, I wouldn't show you this if it was a sad ending. It worked out. This is, I don't know, 5 words or less. Thoughts on this?
My mind is blown.
Genius.
It's not brain surgery, but it is.
But this is a little bit more common, something along these lines. I haven't heard it with guitar before, but I know that because you don't have pain transmitters in your brain, a lot of times when they want to test something out and you're having brain surgery, I've heard people, having to read a book aloud or something like that so that they can test exactly what's going on, make sure they're in the right place, because the brain is such a mystery.
So crazy.
It is. I saw this on Grey's Anatomy many times. It's awesome.
Oh, really?
Yeah, absolutely.
Is it really?
Yeah,
I imagine it is.
Guitar?
Not focal dystonia is what it's called. But where the patient is awake while they're performing brain surgery on to make sure that they could talk and stuff. It happens. I mean, doesn't it make you marvel at modern medicine and what they're able to do?
They just essentially, they did local anesthesia at the place where they did the surgery. And so essentially it's like putting Novocaine, like you're at the dentist, on the area where they cut into.
And for 20 months, this guy couldn't play his guitar and was fixed in 27 minutes. I mean,
absolutely insane.
It was crazy for me also that they were able to identify that they needed to do brain surgery to fix this, because when if my hands were cramping when I was playing guitar, I would probably spend years, and maybe he did, going to different doctors looking at maybe a muscular issue within the hand. But for them to discern that it was in fact a brain problem is so interesting.
Yeah, it says that this musical dystonia is severe enough to impact performance, affects 1% of musicians. I would not expect that to be that common. I know it's just 1%. And anyone conducting repetitive tasks that stimulate the brain circuit is prone to the condition. Patients think that they have a psychological problem. They don't know a neurological circuit issue that can be fixed.
Wow.
It's so amazing.
Like
I love it. One time when I was on a school trip in middle school with Chaminade, Griffin went to the same school. I turned on the TV, and your parents are always like afraid you're gonna see porn. I turned on and saw brain surgery happening, and they had a hand drill.
Wow.
That they were drilling into this guy's skull. And I'm just watching it, and we're all just like, oh God, so gross, so crazy.
I think the
final thought.
The final thought is I had microlumbar discectomy twice on my L5S1 about 2 years ago when I was 27 and a couple years ago, and the impingement on my nerve caused neuropathy to my big toe, and so I always wondered. It was like the most burning sensation ever, and I always wondered. I didn't know why that was happening, and it was because it was a misfire of my L5 of that sciatic nerve. So it's just really weird how after I went to saw a neurosurgeon, I was like, why is this happening to me? Like, what's going on with my toe? But it's just mind blowing, as you said, how they're able to, because the brain is so complex. Like one wrong move, you could end up, with not being able to speak.
So nuts.
Not be able to blink. And it's just like trial and error too.
But I will say, yeah, a lot of brain science was taboo. So we know less about the brain, because it's so much more baffling than any of the other organs, but also because it was taboo to do psychological experiments or research on the brain for so much longer. But to our credit as a society and species, like we can do brain surgery while people are playing the guitar. What do you think? Give us your thoughts. What's the coolest medical procedure you've seen? And thanks for watching. Welcome back, Grace.
Yes, Grace.
Yes, and we'll see you next time on Pop Trigger.